the World Health Organization, WHO, classifies depression as the malady of the century. In the pathological context, one observes the existence of sorrow, negativity, and diminished self-worth, which manifest regularly and may intertwine. Depression further leads to a diminished sense of joy in activities that once brought satisfaction, as well as significant fluctuations in mood and cognition, potentially escalating to suicidal tendencies and actions. Treatment involves professional medical intervention, encompassing medication and therapeutic monitoring tailored to individual cases. Family support plays a crucial role. The global medical and scientific literature acknowledges that depression induces physiological changes in the body, acting as a gateway to other ailments. Individuals grappling with depression may encounter not only persistent feelings of unhappiness and lethargy but also weakened immunity and an increased susceptibility to inflammatory and infectious issues. Depending on its severity, depression can also serve as a catalyst for cardiovascular diseases, such as heart attacks, strokes, and hypertension. A body of evidence indicates chemical alterations in the brain of individuals experiencing depression, particularly concerning neurotransmitters like serotonin, noradrenaline, and, to a lesser extent, dopamine, substances facilitating nerve impulse transmission between cells. Contrary to common belief, psychological and social factors often stem from, rather than instigate, depression. It's important to note that stress can accelerate depression in individuals with a predisposition, likely rooted in genetics. Statistics suggest that 1 in 5 people globally encounters depression-related issues at some point in their lives. The most effective way to prevent depression involves nurturing both the mind and body, incorporating a balanced diet and regular physical activity. Managing stress, confiding in friends or family, and engaging in integrative activities like yoga can complement these efforts. Preventive measures also encompass activities such as reading, acquiring new skills, pursuing hobbies, traveling, and having fun, practices that keep the mind active and filled with positive thoughts. Scientific evidence supports the notion that caring for the body positively influences mental health, with physical activities triggering the release of hormones and other substances crucial for mood maintenance. Regarding nutrition, recipes or diets rich in olive oil, fish, fruits, vegetables, and nuts, walnuts, chestnuts, etc., prove ideal for preventing depression, providing nutrients that safeguard and bolster the neuronal network. Apart from shifts in mood, irritability, anxiety, and distress, depression manifests through various signs and symptoms, which can either be isolated or somatized. The primary indicators of depression encompass irritability, anxiety, and anguish. Discouragement, easy fatigue, requiring more effort to accomplish tasks. Reduced or inability to experience joy and pleasure. Disinterest, lack of motivation, and apathy. Feelings of fear, insecurity, hopelessness, despair, and helplessness. Pessimism, frequent and disproportionate guilt, and low self-esteem. Sensations of uselessness, ruin, and failure. Distorted and negative interpretation of reality. Difficulty concentrating, slower thinking, and forgetfulness. Diminished sexual performance. Changes in appetite and weight, either loss or increase. Insomnia or early morning awakening. Physical pain and other symptoms without medical justification. Several risk factors contribute to the development of depression, including family history, related psychiatric disorders, chronic stress, chronic anxiety, hormonal dysfunctions, overweight, sedentary lifestyle and unhealthy diet, addictions, cigarettes, alcohol, and illicit drugs, excessive use of the internet and social networks, physical or psychological trauma, head injuries, heart problems, marital separation, chronic migraines. Distinguishing between sadness and depression involves recognizing their unique characteristics. Sadness typically stems from a discernible cause, and the individual is aware of the reason behind their emotional state. In contrast, depression is a profound and often inexplicable sadness, persisting even in the absence of apparent triggers. Despite positive circumstances, a person experiencing depression remains engulfed in sorrow. Physiological symptoms, such as tightness, tachycardia, and crying, may accompany sadness. On the other hand, a person in a depressive state may harbor suicidal thoughts. Individuals undergoing sadness often engage in repetitive contemplation of the cause behind their emotional distress. Conversely, depression entails at least 2 weeks of enduring and unrelenting sadness. Diagnosing depression is a clinical process conducted exclusively by a specialized doctor, typically a psychiatrist, dedicated to treating mental disorders. The diagnosis involves comprehensive assessments, including tests and questionnaires during consultations. The psychiatrist delves into the patient's and family history, supplementing the evaluation with specific laboratory tests to formulate an accurate diagnosis. Depression, which can coexist with other psychiatric conditions, manifests in varying degrees of intensity, mild, moderate, or severe. Each case is thoroughly evaluated, leading to an individualized diagnosis and tailored treatment recommendations for the patient. In conclusion, depression is a complex and pervasive mental health challenge classified by the World Health Organization as the malady of the century. This condition encompasses a range of symptoms, including profound sadness, altered mood, and cognitive fluctuations, with the potential for severe consequences such as suicidal tendencies. Recognizing the physiological and psychological dimensions of depression is crucial for effective diagnosis and treatment. Professional medical intervention, including medication and therapeutic monitoring, forms a key aspect of depression management. Additionally, the importance of family support cannot be overstated in aiding the recovery process. The global medical and scientific literature highlights the interconnectedness of depression with physiological changes in the body, emphasizing its role as a precursor to various health issues. Preventive measures against depression involve a holistic approach, addressing both mental and physical well-being. Strategies include maintaining a balanced diet, regular physical activity, stress management, and engagement in positive, fulfilling activities. Acknowledging the impact of factors such as family history, psychiatric disorders, chronic stress, and lifestyle choices is crucial in understanding and addressing the risk factors associated with depression. Distinguishing between sadness and depression involves recognizing nuanced differences in emotional experiences, physiological symptoms, and duration. The diagnostic process, led by specialized doctors, particularly psychiatrists, incorporates a thorough examination of individual and family history, along with specific laboratory tests. Ultimately, depression is a multifaceted condition, and its diagnosis and treatment necessitate a personalized approach. By fostering awareness, promoting preventive measures, and facilitating timely and comprehensive interventions, the global community can contribute to alleviating the burden of depression on individuals and society as a whole. Depression, deemed the malady of the century by the World Health Organization, WHO, is a profound and pervasive mental health challenge that extends far beyond transient mood fluctuations. In the intricate web of its pathological context, depression unveils a landscape marked by sorrow, negativity, and diminished self-worth, weaving a complex tapestry of emotional and cognitive disruptions. This malady not only robs individuals of the joy once found in gratifying activities but can also escalate into profound mood swings and, in severe cases, lead to suicidal tendencies. Navigating the realm of depression requires a multifaceted approach, with professional medical intervention at its core. Treatment involves a tailored combination of medication and therapeutic monitoring, supported crucially by the scaffolding of familial care. The global medical and scientific community acknowledges that depression doesn't merely affect the mind but induces physiological changes, acting as a gateway to various other health complications. Those grappling with depression may contend not only with persistent unhappiness but also with compromised immunity and heightened vulnerability to